All right, this is going to be a long one today. We've got a lot of people out there think the one big beautiful bill doesn't affect them negatively. But I'm going to tell you, if you're receiving Medicaid, it's going to affect you. If you're receiving Medicare, it's going to affect you. If you're receiving the Affordable Care Act, it's going to affect you. If you're receiving health insurance from your private work or you're paying for it yourself somehow, it's going to affect you. So we're going to go into all this today, and please prove me wrong on any of these points, but I'm going to go through the entire list of exactly what's going to happen. This is also a live Q&A. If you've got any immediate comments, make sure you type them into the chat there. If you're watching this on a recording later, type them into the comments, and I'll be more than happy to make a follow-up on any of your questions. Okay, you're going to pay more. That's across the board. So the big beautiful bill, the new magic spell in politics is fraud, waste, and abuse. Anytime politicians say fraud, waste, and abuse, we let them do whatever they want. So this is what happened in the big beautiful bill. They kept saying over and over and over, their target is those people on Medicaid, the lazy gamers, the 26-year-olds that are sitting in their kids' basements, playing video games. Okay. All right. So that's the target. So they're going to target fraud, waste, and abuse. And what actually happened here? Okay, so they cut Medicaid close to $1 trillion over 10 years. So we're talking about 10% every year. So we're talking about $100 billion. And they've also cutting ACA. Some people are going to get their Affordable Care Act marketplace insurance. The premiums are going to go up, in some places up by 75%. And Medicaid cuts are going to happen. A lot of people don't realize this, but what happens is when you run a deficit, there is a law that kicks in. It's called the pay-go law that says if you run a deficit, you have to make up for it some other places. So, but the law says you can't touch Social Security and you can't touch Veterans Affairs, veterans benefits. So the only big one there is Medicare. So it's estimated about $500 billion going to be cut for Medicare. That's capped out at 4%. You think, oh, 4% is not bad. But yeah, the problem with the entire healthcare system right now, it was already, close to the cliff. And this is kind of the tipping point that's going to push a lot of think tanks, a lot of journalists, a lot of politicians, a lot of everybody thinks this is the tipping point that's going to push everything over. So let's talk about that today. So it's going to affect everybody out there. So these so-called, the targets of this, these lazy people that are receiving Medicaid. So they're carve-outs. So if you're receiving Medicaid and you're on SSI, Supplemental Security Income from Social Security, if you're on SSDI, Social Security Disability Insurance from Social Security, if you're taking care of a child under the age of 14, if you're elderly, 65 and older, those are basically most of the carve-outs there. So that means those people aren't going to get their Medicaid cut directly from this big, beautiful bill. It's only for those people between 18 and 64, and actually the expansion states. There's about 40 expansion states. There's other 9 or 10 states that it doesn't affect because they never gave those people that health insurance, okay? So if you look at all the numbers, and of that group of the people that are not working, because most of those people are already working, only a very, very small percentage. So the target is only about 2% of all the people on Medicaid. All the people on Medicaid that this bill directly cuts off, about 2%. 2%, that's it. But it cuts $100 billion from the program. 10% of the program is being cut. And that math just doesn't math. So who's going to take the hit for the other 98%? Actually, it's 99% because the people 18 to 64 are usually younger and they don't use a lot of health care. So they're actually, even though they're only 10%, they probably only take 1% of the budget. But the budget's been cut back about $900 billion. They take 1% of that. So we're going to save $1 billion. Congratulations. But we're cutting $99 billion out of the system. So $99 billion is going to come out of the system for all the other people. So what happens when you kick millions of people off of Medicaid. We've already seen it. We've seen it reported throughout the country. Rural hospitals are already on the brink, and they say, "Hey, Medicaid money coming in. That's the only thing that's keeping our doors open. That's the only thing that's keeping the emergency room doors open. The only thing that's keeping OBGYN open. If you cut that Medicaid off, and people are still going to get sick, they're still going to get injured. So those millions of people that no longer have Medicaid, that no longer have the Affordable Care Act, are still going to get sick and injured. They're just going to go to the hospitals. The emergency room is going to be the new primary care physician like it used to be. So this is where it affects everybody, even the billionaires. The billionaires have their own, their own concierge, doctors on call and stuff like that. But if they're skiing in Aspen with their other billionaire buddies and they, break a leg, they have to go to the local emergency room, and yeah, good luck there. So even they will be affected. So these rural hospitals, I've already talked, there's about 600, I've seen different numbers, anywhere from 600 to 900 hospitals throughout the country that are just on the brink financially, and this is going to put them over. There is a very, very small budget in the Affordable Care Act, or excuse me, in the One Big Beautiful Bill, because they realized rural hospitals are going to be hurt. So they added this at the last minute. They added a $50 billion slush fund in there, but yeah, that's not even enough. And, I'm sure it's going to go, I'm sure it's going to be effectively distributed, right? So this is going to cost increased medical costs for everybody. And this has already been proven. Texas, who did not expand Medicaid, there's 8 other states that didn't expand Medicaid. Wisconsin is a weird situation. They didn't expand, but they've got their own system. But anyway, there's 9 different states that didn't expand Medicaid, and so there's millions of people in those particular states that don't have health insurance, and they go to the emergency room and they just wait for their illness or whatever, their injury to get worse, and it costs everybody a lot more money. So in Texas, on average, people in Texas pay about $1,200, $1,500 more per year because they have to pay for really expensive health care for these people that don't have health insurance that could have gone to a doctor sooner to take care of their issues, so it wouldn't have gotten worse and cost 10 times more, because emergency rooms cost so much more than anything else. So we are going to see states, the politicians that did this, they, were smart, and they said, hey, we're not gonna institute these things until after, we get reelected. So none of this stuff is supposedly federally not going to start until January 2027, but states have to balance their budget. In most states, it's part of the state constitution that the budget has to be balanced, and a lot of these states balance their budgets a year, 2 years ahead of the game. So we already see states already taking kind of a preemptive attack and saying, okay, hey, we're going to get a lot less Medicaid from the federal government next year, the year after. So we need to start kicking people off, making it more difficult, reducing these benefits, reducing networks. So if you're on Medicaid, if you have a hard time finding a doctor now, a hospital to go now, yeah, just wait. Services are going to be reduced. Drugs are going to cost you more money, all down the line. States are going to pinch pennies to try to reduce Medicaid because they just can't come up with that $100 billion, $99 billion difference. And we're going to see them, what's called bureaucratic disenrollment, where they're going to be, not technically kicking you off, but they're going to make it so difficult for you to continue to get your health care that you're just going to fall through the cracks, and they're going to kick you off. And then what happens is politicians are going to come in and they says, hey, we kicked off millions of, these lazy gamers, these 26-year-old gamers. We kicked off millions of these people, and we've saved so much money, so let's cut the budget again. And then they make, which it wasn't the gamers, it was just people that fell through the cracks, and their applications or their recertifications for Medicaid were denied. This happened. If you disagree, again, prove me wrong on any of these. Please, please, please. In your comments, provide me the documentation, the source. But after the great unwinding after the pandemic, Medicaid throughout the country, they cut off probably about 69% of people that were actually eligible for Medicaid, but because of bureaucratic snafus and the fact that Medicaid offices throughout the country don't have, staff to process these claims, people were kicked off incorrectly. And what's going to happen is people are going to be kicked off incorrectly, and then the politicians, the federal politicians, are going to say, "Oh, look at all these people that went back to work. I guess they went back to work." Somehow they disappeared. So I guess we can cut the Medicaid budget even more, and then they cut it some more next time, and then next time,
Hi,
and
my
the
name
next
is
time,
Deborah,
and then just it becomes a
and I
vicious
was watching your
snowball.
program on YouTube,
And they say, "Hey,
and I
success! We
signed up
kicked
for
all these people
Social
off."
Security
Okay,
benefits.
all right, and
when I
then
turned 65,
to make things even worse,
and
part of the big beautiful
I'm
bill,
not receiving
there's
a
going to be
lot,
even
so
fewer doctors.
I
They
went
limited
under my
how
own
much
income
doctors can take,
because it was more than what my
wannabe
ex-husband,
doctors, how much they can take
what I would have
in
gotten if I would have
loans.
gone under his.
And medical
Now,
school is
it's
extremely
been
expensive.
5 years
And
almost since
so
I
the American
signed up
Medical
for that.
Association is
Yeah, it's been 5
American
years.
Medical Association has
So
already come
I'm
out and
wondering,
said this is
somebody
going to
had
be
said at one point
terrible
that if
because only rich
because I am
kids
still
are going to be
working,
able to be able to go to
my
medical
Social Security
school.
benefits
So
may
if
have
you're,
gone up, or
Doogie Howser or
his
whatever,
maybe
super smart, but
have
you just
gone
don't have
up,
the money,
and I could
you're just
draw
going to go
off his, so I
someplace
could
else, maybe to Wall
change
Street and,
what my amount
start
is.
another
So I
bubble or
guess
something.
I need to know if
And
should go and
the
inquire with
graduate
Social Security,
medical
or if it's, I
education
hate to bother them.
residency,
I don't have to,
that
but if
is
you could
tied
answer
to
that question for me, I
Medicare.
would appreciate it.
So
Thank you.
Medicare is one of the largest supporters of residency programs in the country, and you can't be a doctor until you graduate medical school and then do a residency. But the residency positions are declining, and it's getting even worse. So doctors are not going to be able to get in there, and they're going to stop taking Medicaid and Medicare because of all the declining networks and prices and all the rest of it. They just can't afford it. We've already seen, I'm sure you've seen on TikTok and other places about doctors just, being completely fed up with the system. So if you think you're protected, you think none of this is going to affect you, then I'm sorry to say, then it's definitely going to affect everybody out there. Your private insurance, your prices are going to go up. Medicaid, you're going to get declining networks. If you have one of those grocery cards that you really enjoy it until December. We'll see what happens going forward. Particular services, if you're on Medicare, it's going to be cutting Medicare as well across the board. So please, prove me wrong. I would love to be positive on all this and said the American medical system is going to be, healthcare is going to be so much more awesome in the future. But I just looked at the numbers and looked at the policy and looked at the repercussions of those policy. So let's get into live Q&A right now and see what kind of questions y'all have about all things. Someone talked about let's see, waste of money checking people. Waste of money checking people, they just put their money in someone else's name. Okay, so this is about a thing that went out incorrectly. I did a video on this a couple of days ago, but the Social Security Administration came out with this emergency message that said they're going to start checking people's bank accounts. And they've been doing this since 2011. It's called EAFI, and it's for people on SSI. That's it. Supplemental Security Income. SSI is not Social Security. It's not Social Security Retirement or Social Security Disability Insurance, or not spouse benefits or survivor benefits. SSI is SSI. It's a welfare-based program the Social Security administers, and as part of being a welfare, you have to have limited income, limited resources. They've been doing this since 2011. And they just changed it. Before there was a $400 threshold. They just said, no, there's no more fresh threshold. From now on, we're going to check everybody's bank account that is receiving these welfare benefits. And yes, that's how it should be. So somebody out there in social media land took it and went way out into the left field. And said everybody's Social Security is going to be looking at everybody's bank account in the future. No. I mean, I guess the IRS already does that. So, but that emergency message that went out has nothing to do with any of that. So, consider redirecting the war and destruction budget to the benefit of citizens and harm reduction to the rest of the world. Yes. I've always said they should rename the Social Security Administration, because if you look at history, how countries get invaded and taken over is first they kind of decay from the inside. So I always say the Department of Defense defending ourselves from the rest of the world is making a strong country. So Social Security, I think, is our, being an old Marine Corps sergeant as well. I think if we're strong on the inside, then ain't nobody going to mess with us. And it's just not about, building up a bunch of weapons. So when you take Social Security, and if you're still working, you don't have to enroll in Medicare, right? I am working for the federal government. That is correct. If you're still working and still have, if you have health insurance from current work, then yes, you do not have to sign up for Medicare Part A, Part B, C, D, whatever, once you turn 65. But it has to be through current work, and your employer has to have 20 or more employees through your current work or your spouse's current work. You might want to consider signing up for Part A, since it's zero premium anyway, and it might give you a little bit of benefit if you ever go in the hospital. A lot of people do that. So they just sign up for Part A, refuse Part B, refuse the money because they're working, and then later when you stop working, you have 8 months to sign up for Part B, and there's no penalty whatsoever. And if you go onto my website, I've got all of those details there. Completely free website. You go onto Medicare section there, and you click on enrollment periods, and it has the initial enrollment period, and it also has what you're looking at, which is the special enrollment period. And I've even got the forms that you will need. So everything is there. It's 100% free. Let's see. The best physicians and surgeons will just go to private pay. My spouse lost a great orthopedic surgeon because he went private practice, which means does not take any kind of insurance. Yes, we see a national trend of that. So the people that can afford it, yeah, they're paying more. They don't have the health insurance and all the rest of it. And yeah, a lot of doctors are just completely fed up with the entire system. So we definitely need to do something. He's getting as bad as they are at making people worried. He's on this now. Okay, not sure. Oh, are you talking about me? Yeah, if you're not worried about this, then yeah. So what is all the double talk? Who's the woman talking over you? Oh, is there someone? I've got a, oh, let me see. Okay, yeah, not sure. Might have been a video I'm going to be showing. Somebody sent a video in, so sorry I didn't hear it on there. Oh, okay. My little thingy fell down, so okay, there we go. All right, did I say this is a live? All right, since y'all already heard her, I guess I didn't because I lost my little thingy here. Let's go ahead and listen to her now for the other people. Sorry about that. Thank you for letting me know, Sticks.
Hi, my name is Deborah, and I was watching your program on YouTube, and I signed up for Social Security benefits when I turned 65, and I'm not receiving a lot, so I went under my own income because it was more than what my ex-husband, what I would have gotten if I would have gone under his. Now, it's been 5 years almost since I signed up for that. 25, yeah, it's been 5 years. So I'm wondering, somebody had said at one point that if, because I am still working, my Social Security benefits may have gone up, or his maybe have gone up, and I could draw off his, so I could change what my amount is. So I guess I need to know if I should go and inquire at Social Security, or if it's, I hate to bother them if I don't have to, but if you could answer that question for me, I would appreciate it.
Okay, all right. Sorry about that. Playing that over, I didn't hear it. My little earpiece fell out. Okay, I just did a video 3 days ago on spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, and all the rest of it. So this is an ex-spouse that's still out there alive and kicking, so things are different. So if you are currently receiving benefits, then you don't, it's not something that you're thinking that you just get off your benefits and go onto that person's benefits. No, if your benefit amount is less than half of that person's benefit amount, then you need to go ahead and file for benefits on that person's record. If that person is at least 62 years old, it doesn't matter whether they're collecting benefits. That's called independently entitled divorce spouse benefits. So you can file for benefits on his record if your benefit amount is less than half of his. So I would definitely contact Social Security, and you don't need to know the Social Security number. You just need to tell them the name, the person's age, as well as you know it, date of birth, and the city and state where they were born, as well as you know it. And they will be able to find the Social Security number, look at that person's benefit amount, see how old they are and everything, and see if you're eligible for benefits on that person's record. And one of the things you said is, I may have checked 5 years ago, but you're correct in the sense that things might have changed. A lot of people aren't getting the benefits they're eligible for because they check 5 years ago and they get this particular amount. And since then, things have changed. That person has worked more and therefore their benefit has gone up and now you're eligible for benefits. Or that person has passed away and it's no longer 50%, it's 100%. So yes, definitely check. Okay, thank you all for letting me know that someone was talking in the background. So I appreciate it. Let's see here. Dr. Weir, anyone you can reason and keeps up with what is going on knows you're correct. Oh, thank you. I appreciate it. But I love to be proven wrong. That means you learned something. Yeah, if someone says, hey, wait a second, have you ever thought about that? It's a beautiful thing. That means you've just learned something. So I'm on SSDI and they can tell me everything I've ever purchased. I can't even have a savings account. No, SSDI, yeah, if you're on SSDI, they don't ask you for your, they ask you for your direct deposit so they can do the direct deposit. I don't think, it's conspiracy theory is the Department of Treasury is going to go in there looking at. If the IRS gives them a warrant, I guess that's the way it used to be, then they can go in there and start doing stuff. But if you're on Social Security, doesn't care about any of that, what you're doing. If you're on SSI, then yeah, that is a welfare-based program. And yes, there are certain limitations to getting that. So that's great. Check my bank account and see how little money I have left after rent, utilities, toilet paper. Exactly. Yeah. Some people in the comment section of that video said the same thing. Yeah. Check all you want. And if you happen to accidentally deposit a few $1,000,000 in there because you forgot to carry the one, please. Yeah, please do. How exactly will Medicare be cut or impacted? Okay. So here's how that's going to happen. It is basically, I've got a little slide here. Let me see if I can find my slide. It's the pay-go system. And this was enacted in 2010, I think it was 2010, 2011. And it's basically when the government has a deficit, when it runs a deficit, and it's definitely going to run a deficit because of the big beautiful bill, we're getting trillions of dollars to the rich people, and the cuts to Medicaid, the cuts to the most vulnerable, it just doesn't cut it. It's not enough. They needed to cut more money for the vulnerable to give to the rich, but they weren't able to. So there's going to be a deficit, and as part of the Pay-Go Act of 2010, 2011, it says it's an automatic thing. It says if you create a deficit, you have to offset that deficit. It's called sequestration. You have to offset that deficit with cuts in another program. And they can't touch Social Security, the largest program. They can't touch the second largest program, Veterans Affairs. So Medicare is the only thing they can touch. And who gets to choose what part of Medicare gets cut? There we go. I finally found it. Who decides what gets cut? It's the director of the OMB, Office of Management and Budget, Russell Voigt, who was a principal architect of, guess what? Project 2025. So now he has permission to go into Medicare to make cuts wherever he wants. And the law says up to 4%. And you're like, 4%? It's not too much. But it's not 4% across the board. It's like, okay, I don't like this program, so cut that one off. I don't like this one, cut that one off. And cuts begin October 2025. So we're looking at about $535 billion that needs to be cut in there. And under the big beautiful bill, one of the first very variations of that bill, they said they did not waive that law. They could have, in the big beautiful bill, they could have said, oh no, the Pay Go Act, no, we're going to suspend that. But they took that part out. So there is no suspension. So that means this is going to kick in. So what's going to happen is Medicare is going to be, if you're on a Medicare A, Part B, if you're on a Medicare Advantage plan, whatever the case may be, then Medicare Advantage plans are going to be paid less, it looks like, from the federal government. And so they're going to have to scrimp there. And we've already seen some of the repercussions of these companies. They were already planning on doing this, or they're making it even a broader cuts. There's a company that decided they're going to kick about 600,000 people off of Medicare Advantage PPO plans. So when you get Medicare Advantage, you get either an HMO or a PPO. So they're going to kick 600,000 people off these PPO plans. And then another company just came out yesterday, within the last 48 hours, and said they're going to be cutting a lot of plans as well. So you have to use, a lot of these places, you have to use their network. But for those who get terminated, people complain when I said they get terminated, when their plan gets terminated. Okay, I got to make sure. Yes, I thank you for bringing that to my attention. When their plan gets terminated, when their Medicare Advantage gets terminated, and they should receive that, it's called the ANOC, Annual Notice of Change letter from their Medicare insurance company, next month in September. And it'll say, I don't know, we just don't like you anymore. We decided to cancel your plan. So your plan ends December 31st. Well, everybody's plans end December 31st, but your particular plan is not going to automatically renew January 1st because we're canceling that plan. And part of that letter is a golden ticket that you can now get a guaranteed issue Medicare supplement plan if you want one. So this is your opportunity. If you ever wanted a Medicare supplement plan and you were kicking yourself that said, oh, I should have gotten a plan G a long time ago, but I can't now because of health issues. Well, no more. You can get one. So I would definitely check it out. Reach out to Chapter and they can help you out and see what they can do for you. So turning 65 in September and planning on working as long as possible. I have health care through work, but I also have an HSA. When do I have to let go of my HSA? Thank you. Okay, perfect question. Yeah, so you've done your homework. That's a beautiful thing. So I should have added this to the previous one. You can sign up for Medicare Part A at 65, and then refuse everything else. But if you're giving to an HSA, a health savings account, then you have to stop that health savings account 6 months before you start Part A. And Social Security employees and all that won't tell you that because it's not a Social Security issue. If you go into at 65 and sign up for Part A, they'll sign you up for Part A. That's it. They won't tell you about an HSA and all that kind of stuff. That's because that's between you and the IRS. You're just, in order to participate in the HSA, you're getting some type of tax benefits from it. So that's between you and the IRS. Social Security signs you up for Medicare. So that's why a lot of people get that hit and they don't realize it because they don't realize it. I'm self-employed, so I would really like to forego all this medical insurance crap until I get Social Security check at 867. Yep, no problem whatsoever. But you're self-employed, so yeah, you don't, unless you have a company that's 20 or more employees, then you are going to have to sign up for Medicare at 65, unless you're, have health insurance from your spouse who has an employer, 20 more employees. If you don't, then you're going to get a penalty. So if you sign up for 67 and you didn't have creditable coverage, then you are going to get a 20% penalty for the rest of your life. And you're not going to be able to sign up at 67 unless 67, your birthday is January, February, March. You can only sign up at the general enrollment period. So I've been going to the same eye doctor since I was 3 in my 60s, cataract surgery at 4 years old, and now glaucoma. This eye appointment, I was able to get glasses, but glasses aren't covered. Yeah, that's always been the craziest thing, hasn't it? It's like, yeah, how healthy are you in retirement if you don't have vision, dental, or hearing? So that's kind of a scam. Cataract surgery at 4 years old. Wow. I had it when I was cataract surgery when I was like 45 or something like that. And the doctor says, oh, did you bring your pediatrician in with you? because all his, patients were, in their 60s and 70s. So I thought that was funny. That's what happens when you spend all your child life outside in the sun in Florida. They raised my rent twice since I lived here. I live in a shared apartment. Yeah, affordable housing is a big, big, big issue. In Florida, which I have, puts a doctor's name for you to see on your member ID card. Made an appointment, and the person seeing me was a certified nurse. I called, I want a doctor. Yeah, a lot of those, if you get an HMO, they, the gatekeeper for your medical care is your primary care physician. And sometimes it's not actually a full-blown doctor. It's some, whoever. But you have to, if you're an HMO, you have to pick someone, and that's kind of your gatekeeper, that if you want to go to see a specialist, some plans are a little bit different, but if you want to go see a specialist, you have to go through that gatekeeper first. So tariffs have already cost the average U.S. household thousands in lost purchasing power. That equals months of car insurance, electric bills, and groceries. Yeah, and it hasn't really even started yet. It really hasn't trickled, talk about trickle down. They've talked about hundreds of billions of dollars that have already been, produced, and that's essentially hundreds of billions of dollars of a sales tax. It's basically a sales tax because, the importer paid for it, the American company paid for it, and they're going to pass the price down to you. They have stock in their warehouse now, so they're not charging possibly the extra now, but when that stock rolls out and they start bringing that one that they had to pay the extra on, then, yep, it's going to increase for everybody. So, and normally COLA would be figured, COLA would, the cost of living allowance would look at that effective, they come out with the COLA numbers in October, and normally they would look at that and they say, hey, inflation has gone up this percent, 3%, so therefore we're going to give you a cost of living allowance increase of 3% to offset that. But that's how things happened, before last week, when now the politicians have gotten in there and now they can decide how much inflation is, because they fired the Bureau of Labor Statistics, who has been doing those calculations since the 1970s. And now it's, I don't feel like prices have gone up, so we're not going to give you a COLA. So there's so much confusion because Social Security runs regular retirement, SSI, SSDI, all under one roof. Like everyone's bank info will be monitored. Seems SSDI, SSI, SSDI, et cetera, should be run separately. Yeah, but, it actually is within the Social Security Administration. It's kind of the Hatfields and the McCoys in some respect. When you're hired by the Social Security Administration, you're going into a local district office. You're put in one of three different places. You're a CSR; those are the people at the front windows that do the general. They're generalists. And then you got Title 16, and those are people that do SSI, and they do SSI. And then you've got the Title II, which I was a Title II claim specialist, and I did retirement, survivor benefits, and Medicare, and SSDI. And then, so if someone came in and filed for disability benefits, I would do both. I would, as everybody does at Social Security, when they do a disability, they do the SSI and the SSDI at the same time. They take both of those applications. They should always take both applications. And then in the SSI, if it's not an easy slam dunk, you've got over $2,000 or $3,000 in the bank, so therefore you're denied. Then if there is a possibility you can get SSI, then we pass that to the Title 16 CS, who develops the SSI portion. And it's always, every time I hired people, I still have, hi, Stephanie, who says, why did you put me in Title 16? I wanted to be in Title 2. And so, sorry, Stephanie. I wonder if she's ever gotten over it. So I know a Canadian who came to America to get cancer treatments immediately. He said it would be close to a year to get treatments back home. Yeah, if the American health care system, if you have the money, yeah, it's one of the best in the world. Yeah, no doubt about it. If you got money, yep, it's awesome. But there's the issue. And in Canada, you don't necessarily have to have money. Are there waiting lists in Canada? Yeah, they're run by the province. So some provinces have a little bit longer waiting lists for, yeah, is it a perfect system over there? No. Is it much more than better than our system in a lot of respects? Absolutely. There's other countries that have a lot better systems. And I'd say we just, we don't take the worst of another system. We're Americans, we're pragmatists. We look at, okay, well, this really worked in this country, let's take that. This really worked in this country, let's take that. But we decide that, well, if this country is doing things bad, I guess there's no examples anywhere in the world that we can copy. So we just keep on going. Yeah, that makes no sense whatsoever. So I get SSI on top of my Social Security retirement. They subtract my Social Security retirement from the 967. Yep, that's exactly how they do it. I get the difference. Will this rule have an effect as long as I stay below the asset limit? Yes. If you go above the asset limit, then they're going to cut off that SSI portion until you spin down or something happens to those benefits. Yeah, it won't affect your retirement benefits because there is no asset limit for your retirement benefits, but it's just on your SSI part. So that's how they do it. So people can get SSI and retirement benefits, SSI and disability benefits, SSI and survivor benefits. But the max they'll get this year is $967. So, all right, I think I've got a few more video questions. Let's see what else we have here.
That person, I don't want any money from that person.
Yes. Can you file doctor benefits if you're already on disability?
Okay, very short question. Her question is, can she file for other benefits, spouse benefits, survivor benefits, divorce spouse benefits, if she's on disability? Yes, absolutely you can. We just talked to that young lady there. And a lot of people miss this because they say, well, I'm on disability benefits and I am 58 years old. And if I file for whatever other benefits, then that's going to kick me off disability benefits, and therefore I'm going to lose my Medicare. 100% incorrect. If you're receiving disability benefits and you're 60 and you're eligible for survivor benefits, you get those survivor benefits on top of your disability benefits. One offsets the other. And because you have disability underneath there, your Medicare still continues. Same thing when you turn 62, you're eligible for spouse benefits. You can get those on top of your disability benefits. And remember, one offsets the other. So, all right, let's see what else we got here.
When I signed up for Part B medical insurance and then discovered a while after that I don't need it. And I'm trying to sort out how to get out of it and stop making payments. Can you let me know how I stop making payments if I don't need the Part B medical insurance? Thank you.
Okay, so yeah, the payments are probably being taken out of your Social Security check. So you need to reach out to Social Security and tell them you want to refuse Part B. But be careful, and when you refuse Part B, they send you this form, 1763, and it says on there, it has a lot of verbiage on there. It says, you understand that, by refusing Part B, you don't have, if you don't have other creditable coverage, then if you change your mind later, you're going to be penalized 10% for every 12 months you didn't have it, and you can't sign up until January, February, March. And so, yeah, and this is Part B and Part D as well. So, possibly you're a vet and you have VA and you don't want to pay the $185. What I would do is a couple of things first. If you're having a hard time paying for that $185, reach out to Medicaid, see if they're willing to pay for that $185 for you. Option B would be reach out to Chapter there and say, hey, what are these Medicare Advantage Part B givebacks? And a lot of them are directed to vets in your situation, and they pay for part of your Part B. See if there's one available in your area so you can keep your Part B, but not have to pay the $185 or part of it, or depends what's available in your area. So I would definitely check that out. But if you've done all your research and 100% you're never going to go back to Part B, then you just need to contact Social Security, sign that form, attest that you understand the penalties if you change your mind later, and then they will take care of it for you. All right, let's see what else we got here. Somebody's shy.
Hi, my name is Shirley from California. I decided to take my Social Security early by 2 years. Social Security office told me I qualify for spouse benefits and told me how much I would be getting. I was hoping to delay my spouse benefits until I reach full retirement age. Am I allowed to postpone spouse benefits? Thank you for all you do.
Okay, this is it really depends on your particular situation. Social Security has this thing called deemed filing that you have to file for any benefits you're eligible for once you start those type of retirement benefits. So if you're receiving retirement benefits and let's say your current spouse is receiving retirement benefits, then you have to file for spouse benefits. You can't wait till your full retirement age to get more of them out. You have to file at the same time. Same thing with the divorced spouse, independently entitled divorced spouse. Survivor benefits, different. You can refuse those and let one increase, but deemed filing, and a lot of people, they tried to get around that and not file, but if they file a year or 2 years later and the Social Security employee discovers that, or the Social Security computer system picks that up, it will say, hey, you were technically supposed to file a year ago, so we're going to make your MOE, your month of entitlement, a year ago. So yeah, so you might just want to bite the bullet and check it out. All right, we got a repeat customer here. Let's see what he says.
Hi, Dr. Ed. Bruce Hill from Chicago again. Ran into another neighbor who is on a Plan G. I know you don't like using company names, so I'll just use MO as the company. And his rate's very high. And I talked to him about possibility of going to a Plan N in the birthday rule in the state of Illinois, which is 45 days of your birthday. He said he contacted his broker, and the broker told him that because his company, MO, acquired somebody, whatever he was trying to say, that the birthday rule does not apply. Can you tell me if that's true or how we can help him and possibly get him on a Plan N? I did ask him to kind of...
Okay, yeah, it's kind of hard to hear there, but he's got a friend, so awesome. Looking out for your friend. So if you have a video question or if you have a friend that has a question, grab your phone, go to my website, mygovexpert.com. You'll see a little phone icon in the bottom left. Press that, record, put it in your friend's face or your face. You don't necessarily have to show your face if you don't want to, if you're shy, and then record it. And I'm also going to be looking for, if you're at your local Social Security office and you see the line down the street, take a picture of that. If you're at the Medicaid office, if you're having an issue, we want public recorders out there. You're reporters, so go out there and report the information, make videos, send them to me, and then I will put it up as part of this YouTube. And we need to get the information out there. We need to stop people out there trying to fight the system by themselves. So we need to get together as a community. Okay. So Plan G, yeah, it depends. There's 3 ways to buy Plan G, the way it's priced, but your friend's prices are going up. I have never heard, yeah, some states have birthday rules where you can switch your plan, from around your birthday, and there's no health underwriting. I have never heard of a state's birthday rule being terminated because one company bought out another company. I know exactly which companies you're talking about, but yeah, that doesn't override the state's, regulation that there's a birthday rule. I've never heard of that. That's crazy. I know, a G is a guaranteed issue, and maybe your state doesn't include the N as part of the birthday rule, from a G to an N, maybe from an N to an N or N to a G, but maybe not a G to an N. But it really depends on the particular state. So I would have him reach out to Chapter. They're the experts in this, and they're 100% free, and they will check to see if, in fact, yeah, it is, but whether he can switch. The whole thing, one company buying out another, and that negates the, I've never heard that one. That's a strange one. So why do some of us who receive Social Security benefits have to pay the IRS at income tax time? Yeah. It's on my website, it has, on taxation. Yeah, some people have to pay taxes on their Social Security benefits. About 50% of people don't pay taxes on their Social Security. If you're just basically, all you receive is Social Security and maybe a little bit of other income, then you don't pay taxes on your Social Security benefits. But on my website, if you go into Social Security, click on retirement there, and then go down to the little tab that says taxation. It's got all of the thresholds and whether you have to pay taxes at all. Let me double check my little link here, make sure it works. Sometime the links are, yep, there it is. It goes right to the IRS website and it says, are my Social Security or Railroad Retirement Tier 1 benefits taxable? And there's just a few little questions. It takes about 9 minutes and you can see if your benefits are taxable. So just go onto my website, mygovexpert.com, and it'll have that link for you. Let's see here. I don't want to put a name to 2025. Okay. Color earlier had said that they were asking him to prove all the stuff he was spending his money. And I think the only reason that happens is when they have a payee. Good catch, Peter. If you have a representative payee, it's called, you're not able to take care of your own benefits and Social Security appoints someone to be your representative payee, then once a year, they send a payee report. And then it says, hey, we sent you $24,000 last year for this person. You're taking care of this person's benefit amount because they can't take care of it themselves. We sent you $24,000 for that person's welfare. How did you use it? Did you use it for, their housing, food, medical care and stuff like that? And then you just fill it out and return it. So yeah, that's definitely something they ask for. Absolutely. And that started when this, many years ago, this one lady used to take in boarders, homeless people, and then bury them in the backyard and keep getting their Social Security check. So Congress said, hey, Social Security, you need to check that thing every now and then. So to make sure that doesn't happen. So that's how it happens. That's why I have an Advantage plan. I couldn't pass the underwriting to get a G or N. Yes. And that's what a lot of people do, unfortunately, is at 65, when they're still young and healthy, they say, well, why should I get a Medicare supplement plan? Ed always talks about, he always prefers, an N or a G, but, my budget, if your budget is not there, then it's not there. But if you have even if you're able to afford it, people say, well, I'm young and healthy now. Why should I pay $80 or $100 or $125 for a plan N or G or something like that when, I haven't gone to the doctor for a few years? And I could see that argument. And you say, well, I'll just switch later, when I think I need it and I'll have to go to the doctor more, and I don't want to deal with prior authorizations and networks and all that stuff. So when I'm 67, 68, 69, then I'll go ahead and do it. But then, life is what happens while you're making other plans, something happens. And then one day something really bad happens and you're not able to switch to a plan G or N anymore. So that's unfortunate. So a previous call I had mentioned that they were making him approve that what he needs to spend his money on, and you didn't mention anything about a pay. Okay, yes, so just did. Thank you for, I don't think it was a payee type thing. He was talking about his own benefits, but yeah, that's good information to throw out there. I appreciate it. Spitfire, thank you for answering my question. You're welcome. I don't read the questions before I press the button and show them up on screen, so everybody please be nice. This is live. The politicians will still have their special healthcare system, no waiting, straight to the best specialist the taxpayers can pay. Yes, that is a fact. I keep losing my little headpiece there. Oh, let's make sure, make sure this doesn't start playing there. Okay. Okay, IRS thing. Let's see what else. Do you have other income? Do you file a joint return? Ask your accountant. Okay. And some people also sent me another video they wanted my feedback on about a fraud case, an actual Social Security fraud case. So let's listen.
Walsack stole upwards of $10 million in Social Security money, Medicare money, and Medicaid money, but he got caught. And the judge sentenced him to 18 months in prison for his crimes and ordered him to pay restitution to the federal government of $4.4 million of that Social Security money he stole from the federal government, from we, the American people, from the taxpayers. And he was about to report to prison to start his prison term, but Donald Trump's pardon of Paul Walzak puts the lie to, I will protect Social Security, and I'm appointing Elon Musk to find the fraud. Well, wait, sport, we found the fraud. Paul did it, and he was ordered to repay what he stole from us, the American taxpayers, $4.4 million. We found the fraud. It's Paul.
Okay. And people ask, is that accurate? Yes, it is. The part about, yeah, he stole, I did a video on this when that first came out a few weeks ago. He stole, he had a bunch of employees. I guess him and his mother had nursing homes or care facilities in Florida there. And they, as an employer does, they get money from their employees. Their employees pay their, Social Security, Medicare, the 6.2, the 1.45%. And he decided he's just going to use that money to go on expensive vacations and, fly around on jets and, buy Chanel and Louis Vuitton or whatever the case may be. And yeah, he stole quite a bit of money from Social Security and Medicare. The Medicaid thing, yeah, I'm not sure. I mean, when you steal taxes, I guess you ultimately steal from Medicaid. But yeah, there is no money that comes from his employees in Medicaid. I'm not sure how that got in there. I haven't looked at the details of the case that closely, but I don't think it's Medicaid that was included. But yes, he did steal millions and millions of dollars from Social Security and Medicare, and then we have to pay it back because when he was pardoned, and how was he pardoned? His mommy went to Mar-a-Lago with allegedly a satchel of cash, $1 million. Donated somehow to Mar-a-Lago or that circle, and her son was pardoned. So did not have to go to jail, did not have to collect the $4.4 million. We have to pay it as American citizens. We have to pay that money back. And yeah, Elon Musk was supposed to look for that, and he decided to go down some rabbit hole and supposedly look for people that are 200 years old receiving Social Security benefits. And guess what? He never found them. So there's that. My primary is that on my Medicare card is actually a specialist for some reason. My real primary physician isn't listed. I see many specialists. Should I contact my insurance company, Medicare? Yeah, I would definitely contact them and find out. Maybe your specialist does double duty as a primary care physician and a specialist. So maybe that's, yeah, usually they won't list it on there because the Medicare insurance company has a list of, those gatekeepers, those primary care physicians, and it's strange that they would add that on there if that person wasn't allowed to be your primary care physician. So I'm thinking that doctor probably just does double duty. They're a primary care plus they're, ear, nose, and throat or something. So, but yeah, I would definitely check. I would definitely call them up and say, hey, is this really my primary? So it doesn't hurt. But and they'll send you out a new card, no problem whatsoever. And that's one of the great reasons my son and I chose Chapter to help is because they have a member success team. And when you have issues like that, if you're a client of theirs, you call them up 365 days of the year, except for on Sundays. But anyway, New Year's Day or whatever. You just call them up all year long and say, hey, I just got this weird bill in the mail. I need to do this. I need to find another doctor here. And yeah, they're one of the only ones that really, really, really help you after you enroll. They help you enroll free. They look for your plan for it, but they don't end there like a lot of companies do. So there's no doubt the gentleman is really helping. I appreciate it. You haven't seen nothing yet. I'm taking off. My regular viewers know I'm taking off for a few days. And I'm going to be working on a project that is going, I think it's pretty awesome. But well, it's only going to be awesome if y'all help out. So I'm working on that over the next few days. So I'm going into seclusion to focus on that. And then I'll be back probably Friday or Saturday to do my live Q&As again. So What happens to all the money that Social Security Administration penalizes people for retiring early or die before taking Social Security, since those are permanent penalties? Yep, just stays in the Social Security Trust Fund. So, yep, it's just money that doesn't go out, and it's not taken out of the Social Security Trust Fund. If you are, if you work if you're under your full retirement age, and you work, and Social Security holds back $1 for every $2 you go over, then you pay that money, and it goes back to Social Security. If you have to pay taxes, you're one of the 40% of people that actually have to pay taxes on your Social Security benefits. A lot of people don't realize that money goes to Social Security. And they say, no, it doesn't. I pay the IRS when I have to pay taxes on my Social Security. Yes, you do. And then the IRS gives that money to Social Security. And the 2024, this is the Social Security Trustees Report. And there it is right there, taxation of benefits, $54 billion. So $54 billion, those people that are working and, getting Social Security benefits, and their earnings are high enough to be taxed on those Social Security benefits. They pay tax on those Social Security benefits, and then it goes back to Social Security, $54 billion. So, yep, it all goes back into the system. Let's see. Many nurse practitioners can be better than an MD. Yes, I agree. Yes. In my experience, they have more care, spend more time, and actual look into things more than a doctor that many times makes assumptions. Yes, I agree with you there, 100%. So, Jason, do you think the day will ever come when people just take the risk and go without health insurance? Like most human history, insurance is a modern idea. Yeah. But it is a really good idea. Pooled risk. I mean, we can go back to, all you got to do is study history of the Dark Ages and the bloodletting and stuff. That's where, the barber pole came from. The red and white barber pole is they used to bleed people because they figured that was the solution to everything. So they take some blood out, throw the bloody rags on this white pole, and that's where you get the red and white barber, because barbers used to also bleed as well. So yeah, I'm not going to join that system. And I can't afford, a $200,000 cancer treatment if something like that happens to me tomorrow. So I am dependent on my community and the rest of the country for a pooled risk. So that's what insurance is a pooled risk. So it was actually kind of started by the Scots, during the 1700s, Adam Smith and all that. So used to be for ships going out, So anyway, but I won't digress into a historical lesson on the development of insurance. I'm 53 and never had a review. I became physical and mental disabled in 2012. Is it normal to never get a review? I had a traumatic brain injury plus chronic medical condition. Should I ask? No. No news is good news. If they don't give you a CDR, continuing disability review, it's either a medical one or a work one. If you ever work and an alert comes up, they will send you a work CDR, but it doesn't sound like that is your case. And then when you were approved, then they determined that your disability is permanent. So even then, because of, medical advances and stuff like that, it's like, we used to have this guy, he lost both of his legs, and the system pushed out a medical CDR and asked, and he said, yeah, no, they have not grown back since. So he had a really good sense of humor. So anyway, but that doesn't necessarily preclude people from work. Some guy named FDR worked and he couldn't walk either. But anyway, so medical advances and stuff. So sometimes you might get a medical CDR. You just fill it out. That's part of my new project, is to help people with CDRs, making sure they're not denied, make sure they're not stressing out on CDR. So that's part of my new project. SSI is going to be part of the new project. Medicaid is going to be part of the new project. The Medicare Savings Program, all the rest of it. So that it's a big project, but yeah. I'm going to need your help once it comes out. So yeah, you can, if it makes you sleep better at night, call them up and ask them when your cycle is for CDRs. And if they say, never or every 7 years, remember, even if your cycle is up even if it's your turn, like this year is your 7th year, or whatever, they still might not send you one because they just don't have the budget. That's a separate allocation that Congress has to do those continuing disability reviews. So if Social Security doesn't get a budget from Congress to do those, it won't do it. So there's that. All right, I think we are at an hour, and I think that's it for today. I've got tons of questions. I'm sorry I wasn't able to answer all of them. Let's see. Let me get one or two more here. He has been trying and getting set aside by the politicians who'd rather keep their riches. Yeah, that's probably the biggest problem with everything, and why everything is, really working against, the public, the regular people, is Citizens United. It's all about money. Money is speech nowadays, and money controls, politics. So it's unfortunate. So, all righty, that'll be it for today. I'll be off for a few days. I'll be back Friday, Saturday or so. But keep on keeping on, and we'll see you then. Have a beautiful, beautiful day, and please, please, please take care of each other.